At Healthcare Partners Medical Group, our mission is to provide the highest quality of healthcare to each and every patient. With 5 locations in Pahrump, we are local doctors you know and trust. We want to thank you for choosing us. Quality care starts here.
Well, will the state have to add a gas tax to help pay for the roads? Here's your news across Nevada. In February, 15,993 initial unemployment claims were filed in Nevada compared to 17,336 in February 2012. That's a 7.8% decrease over the year, the 36th time in the past 39 months that claims have been lower than the year before, and only the second time since prior to the recession that the level of claims was below 16,000. Initial claims peaked during the recession at 36,414 in December of 2008, and since then, the low point for initial claims was 13,932 in September of 2012. Republicans who want to close a campaign finance loophole that allows some former elected officials to hold on to campaign cash presented their bill today. AB 178 requires anyone who qualifies as a candidate to dispose of unused campaign funds within 2 years if they don't actually file as a contender or appear on the ballot. Advocacy groups for cancer patients are backing Nevada legislation to give parity to patients on oral medication. SB 266 seeks to make Nevada the 23rd state with what supporters call an oral oncology parity law. The measure would require insurers to provide coverage for oral drugs that is equivalent to conventional intravenous drugs used in chemotherapy. The American Cancer Society Cancer Action Network says patients shouldn't have to pay more for treatment because they're prescribed oral medication instead of intravenous drugs. Unlike intravenous drugs, oral medication is considered a pharmacy benefit with no annual out-of-pocket limit, and patients on oral drugs end up paying much more. If Nevada expects to maintain roads and highways as the state population grows, tax on fuel must be increased by 2.8 times to keep up with the demand, according to a report released this week by the UNLV Center for Business and Economic Research. In 2012, the Nevada State Highway Fund ran a deficit of $136 million. They project that a deficit will increase to $220 million by 2020 and $284 million by 2025, and then $377 million by 2030 if nothing is done to increase revenue. Nevada taxes its motor fuel sales on per gallon basis, which means that tax revenues have not kept up and will not keep up pace with inflation. To fix the deficit, the state would need to increase its current tax on motor fuels by 17.65 cents per gallon at an average rate of 6.8% each year over the next 17 years. If fuel taxes are not increased, the state must consider alternative options, such as checking odometers at the end of every year, to charge mileage fees, or vehicle registration fees could be increased to meet the funding demand for the new roads. In 2011, Nevada had a population of 2.7 million people, and the annual vehicle miles traveled in the state totaled 22.4 billion. The population will grow 1.08% annually and will reach 3 million by 2020 and 3.3 million by 2030, according to the Nevada State Demographer. I'm Deanna O'Donnell. That's your news across Nevada. The Mr. and Ms. Relay Contest was held last Saturday at the Sanders Family Winery on Kellogg. This event is one of Pahrump's fundraisers to benefit the American Cancer Society's Relay for Life, which will be held right here in May. On Saturday here at the Sanders Family Winery was the Mr. and Ms. Relay Contest.
That is actually where the guys dress up as girls and the girls dress up as guys. They actually do a formal walk around, they do a question and answer, and they do a talent. Could be a really funny talent, it could be a serious talent, whatever they wanted to do.
So we have 3 judges there as well. Tell me who they are.
They are Tom Waters and Karen Jackson and Bill Dolan.
And they're judging based on not only the costumes, but the question and answer portion?
Yes, the question and answer portion, plus their costumes and plus their talent.
And then you also have the Pahrump Gunfighters out there doing a little skit. Tell me a little bit about the afternoon's activities that you're going to be having.
Okay, we got the Gunfighters. We also have Mrs. Doubtfire here who's been telling jokes and stuff. We got the Gunfighters working. We got, of course, the great Linda DeMayo filling in and everything.
This is a fundraiser for the American Cancer Society for the Pahrump Relay for Life. When is our relay going to be held?
It's going to be May 17th and 18th from 6 o'clock at night until 12 noon the next day.
People can still join the Pahrump Relay?
Yes, you can. We right now have 22 teams. You can join a team or put together your own team. And you can join all the way up to it. We're doing fundraising. There's going to be lots of fun things going on. And so, look at the papers and different things that are going to be going on to help the cancer walk.
What's coming up next for the American Cancer Society's Relay for Life fundraising events?
We're going to have Dine with the Divas at the Elks Lodge. That's going to be on April 14th. On April 27th, we are going to have a powder puff racing at the racetrack. It costs $30 if you want to race, or it costs $10 to get in. The racetrack is donating $1 for each person, for each men's, to the cancer walk.
For people to find out more information about the American Cancer Society's Pahrump Relay for Life, how can they do that?
It's PRMPrelay.org.
Yes, PRMPrelay.org for donation stuff. Is also have the schedules of your events on there?
Yes, we have the schedules for the events, and you can sign up for teams. And then there's phone numbers on there that you can sign up your own team or what you want to do.
For more information on this year's Pahrump Relay for Life, you can go on the web. This is Deanna O'Donnell for News 46. News 46 reported on a recent Harvard study that said sugar-sweetened beverages are linked to more than 180,000 obesity-related deaths annually worldwide. We spoke to Healthcare Partners cardiologist Dr. Tally Eric regarding the study. There was a Harvard study. 180,000 people maybe have their deaths contributed to sugary drinks. Is that true? Tell me about what you think about that study.
What that was about was a statistical analysis where the scientists and statisticians extrapolate from known data about calorie consumption, sugar and carbohydrate consumption, and its relationship to obesity and what we call metabolic syndrome, which is diabetes and hypertension and abnormal blood fats or lipids, and then take that information and say, well, if that's so, then how would that affect the whole U.S. population? So
that's where they're getting those numbers.
Well, the numbers in terms of causation are real, but then, it's an extrapolation as to, well, this is what could result if this is how much people are actually consuming these drinks.
And in the study, it doesn't just say sugary sodas, it says all sugary drinks. This comes right at the heels of New York's judge repealing that law.
I think all of this is really interesting. I mean, I think it's indisputable that if you concentrate calories, and the easy way to do that is just to take sugar or glucose and concentrate that in a drink, it makes it very easy to consume. Let's just really be frank and realize that, a big part of industry in terms of the food business is promoting products, and a lot of these products are oriented to children and teenagers. They're packed with calories, and as you suggested, we're not really just talking about soda. We also have to talk about fruit drinks. You can't just provide your child a, say, cran apple juice as a substitute for Coke unless you read the label and realize that may actually have more sugar than the can of Coca-Cola.
Should you go to the more natural? Should you be reading that label and making sure that it's 100% fruit juice? Is that going to be a good substitute, or should you just try to offer a little more water?
Well, that still depends. I think you have to read labels, because just because it's sugar coming from fruit juice doesn't make it better than sugar coming from Coca-Cola. Calories are calories. If the calories are coming from glucose, at the end of the day, you've got to look at the number of calories coming from the sugar in that product. And the more concentrated it is, the more easy it is to take in those extra calories. And with this lifestyle that we have, that we've talked about in these previous interviews, where we're not as active, we're not as physical as young children, as teenagers, young adults, it becomes much easier to get a calorie imbalance translating into heavier people. Just because you're heavy, as we talked before in an interview, doesn't mean you're going to have heart disease or a heart attack. But heaviness correlates with hypertension and diabetes, and those things promote cardiovascular disease and other medical problems.
And cardiologist Dr. Eric spoke to us about the effects of drinking sugary beverages in part 2.
I was shocked. Surveys on calorie intake and food consumption by teenagers in the United States show that the percent of calories consumed from sugary drinks has doubled in the last 10 years to where now instead of 10% of the person's calorie coming from sugary drinks, it's a little bit over 20%. I don't fault Mayor Bloomberg for trying to legislate something. 6 out of 10 people in the city are heavy. He understands what most politicians and policymakers do, which is that health translates into higher costs for everyone, more taxes to pay for health care, overall higher health care dollars. I mean, let's face it, he is a little bit messianic about the things he believes in. But we try to regulate health and welfare in all aspects of our lives, whether it's safety of vehicles, safety of food products, safety of medications, airline safety. None of this is a surprise to anyone, but I think for a lot of people, the issue of food and food intake and what you can drink and how much you can drink is taken very personally.
What about diet sodas?
The diet soda itself has no calories, but the diet soda by itself isn't going to make someone heavy. There's no caloric value there. But studies show that when you take that to replace calories that you want to get rid of, you end up taking them in through something else. So let's say you have your diet soda. That doesn't seem to stop people from having a supersized fry and a triple Mac. So there you go.
What would you recommend a parent or an individual to do instead of going the direction of these high-calorie drinks? Should you go to water? Is tea's a good idea, or what?
First, I think you have to know how to read a food label, and you have to actually read it and ask yourself, okay, as part of my daily intake of food and drink, where does this fit in? Does it fit in? So I think it starts a little bit with food education, which relates to knowing about the ingredients and building blocks of a healthy daily diet. And part of that is knowing how to read a label.
Some people don't look at the drinks as something that is taking in calories. They look at their food. Well, this is what I ate today, but they don't count those other drinks.
I think again, it's an educational matter. It's not easy to tell people, oh, just drink water. I mean, who wants to drink water? It doesn't have much taste. It doesn't give you a buzz. You know.
So as far as that's concerned, definitely look at everything that you're taking in per day.
I think it is, and that ties into a conversation we had recently about making different choices in foods and how that can lead to better health over time. There are no miracle cures here. This is all over time, but the good habits start young.
We'll have the Nye County School District's Tip of the Week coming up after this break.